by the time they cut the cast off, his leg was like this instead of setting it properly. So she brought him into me. And the issues was that his mom was worrying about us. He couldn't sit down properly because his leg kept sticking and different, you know, so it was really hard for him to get into a comfortable position, and he couldn't use it. So as soon as they removed the leg, he was able to hop around completely normally and sit down normally. And as I'm sure you guys know, like all amputees, he adjusted within hours. You know, he just did so well without that leg. I mean, I hate it that people think that that's such a quick option, but sometimes it really is better, huh? I think that rear leg amputees are so much easier to work on. Their mechanics aren't quite as difficult because they're still using the forelimbs pretty normally. Some of them will get a little bit of a broader stance in front. Actually, I should say that most of them do have a little bit of a broader stance in front, and they'll take that back leg and move it into the center instead of having it out to the side. But what that does is it tweaks their, just like the forelimb, the back legs amputees, it tweaks their back into like an S shape. So you tend to find pain in different areas. With the forelimb amputees, I find a lot of pain up front, and you know, in the mid spine, not so much in the lumbar spine. In the back limb amputees, I tend to find more pain in the thoracic spine here because they're moving that leg in. So you just find pain in different areas. But I think it's a lot easier for a hind limb amputee to walk. They don't appear to struggle so much. And I feel like they seem to recover a little bit faster than the forelimb guys because it's just easier to get your balance back when you're losing the leg that you aren't quite so weight bearing on as opposed to the ones that you're putting all your weight on.
So I was just thinking, is it worse to leave a stump or not when it comes to their body mechanics?
If you ask 10 vets, you'll get 10 different answers. I like leaving the stump. I support it because it does help their balance. It's just like cutting off a tail. Dogs, and this is especially with a lot of, you know, neurological and paralyzed dogs, when you take off that tail like a Rottweiler or a Doberman or even a Cocker Spaniel, they lose their ability to balance themselves, and we see it all the time. They use their tails like a rudder on land and in the pool. We watch that a lot, and I think if you leave a stump, you just give a little bit more balance. So the benefits of heat versus cold, what you want to do is always, always, always use cold initially. So for the first 48 hours to sometimes 3 days, you're icing because you really want to reduce swelling and inflammation. As soon as the injury is no longer acute, or the amputation or whatever it is that has happened to the dog, then you switch back and forth between ice and heat. And it really depends on the dog. Most dogs prefer ice, crazily enough, because ice reduces swelling and it reduces pain and soreness in an area. What I like to do sometimes is do ice, heat, ice, but you always want to end with ice. And you would do 5 minutes ice, 5 minutes heat, 5 minutes ice. You always want to put something in between your dog's skin and the ice pack, even if it's just like a washcloth or a really thin towel, because you don't want to freeze or burn the skin. And obviously touch the heat before you put it on your dog to make sure you don't burn them.
Yeah. So how would you recommend people with giant breed dogs approach it? Because they're the ones who come to us like so stressed out.
You know what I do with those dogs is get them in the water. You know, I put all of my Danes in the pool immediately. I mean, even if they're not a water breed, which of course a Dane isn't, I do so much swim therapy with those dogs because their backs are so torqued out and they're so heavy, just physically, not even if they're overweight, that the only way they can, to me, the only way they can get really good function is by routinely swimming them, because you get all that weight off and you can actually use your limbs normally in the water. So anytime you've got an amputee that's a giant breed, I would get a floaty coat. I would never, ever, ever swim them without a floaty coat, but get a floaty coat and just do short sessions, you know, maybe 5 minutes with a couple of breaks, work up to 10 minutes with a couple of breaks, work up to 15. But, you know, monitor your dog's heart rate and respiration rate, make sure they're not stressed, but just do real gentle swimming. If their cardio fitness is good and everything else about them is okay, especially, you know, if they're otherwise healthy. If you can, we want the pool at about 85 degrees.
Okay.
But if you have a dog, like a lab or a golden, that loves the water and will dive into a lake or a river or a stream, I say go for it. Let them set the pace. I would never force it. Let them do what they want to do. But if you're doing therapy, yeah, you want a heated pool. My brachial plexus avulsions, the dogs that have nerve damage, we try a lot of swim therapy because you can get function back. Even if you know, they're just kind of dragging the leg around. If you're willing to put the effort into it, a lot of times we can fix the leg or make it so that it's functional enough that they can keep it. But yeah, amputation is painful, and you know, they get phantom pain just like we do. You know, when anybody has a limb removed, they still get those phantom pains.